Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Today, credit scores and mental health. Dr. Catherine Ettman, a health policy expert at Johns Hopkins, joins Stephanie Desmon to discuss her research into how much credit scores matter for financial health and how poor scores are associated with higher anxiety and depression levels. Let's listen. Catherine Ettman, thanks so much for joining me.
Thank you for having me.
Today, I wanted to talk about this link that you're seeing between financial and mental health. And most recently, I saw that you have done some work regarding credit scores and mental health. And I wanted to start super easy for our listeners, which is, we know what a credit score is, but tell us a little bit about what goes into a credit score. They're not just a number.
Credit scores are used to calculate a person's financial risk. Various factors feed into credit scores. They include payment history, so whether people paid their bills on time, the amount owed, length of credit history, so how long they've had accounts open, new credit, and mix of different types of credit as examples. Now, credit scores are just a number, but they are an important number. They can influence a lot of different factors and financial opportunities for people. For example, credit scores can determine the amount that people pay for loans. So people who have higher credit scores get preferential rates, whether it's mortgages or auto loans or business loans. Credit scores can also be used in employment, so employers can do credit checks. They can also be used when screening tenants for rent. So some apartments may exclude people from being able to live in their units because of their credit scores.
So your study looked at what?
So in this study, we wanted to understand the relation between area-level credit scores and individual mental health. In this study, we looked at the state of Pennsylvania. We looked at credit scores at the area level in 1,438 Pennsylvania zip codes. And what we found was that people who lived in areas with lower credit scores had higher odds of reporting symptoms of depression or anxiety.
So how did you figure that out? I mean, it's not just a factor of income.
Exactly. So in this study, we wanted to make sure that we controlled for income. So we looked at unadjusted associations. So that's just when you look only at credit scores and only mental health. And there was an association there, as we would expect, because in isolation, a credit score might be a nice indicator of a person's financial standing. However, that might include in it things like income and other economic variables. So in our study, we wanted to control for other demographic characteristics, including income. And what was interesting was that in the study, even when we controlled for area-level income, we still found a significant association between area-level credit scores and individual mental health.
Why do you think that is?
Well, in our work more broadly, we have looked at the relationship between different types of assets and mental health. We have defined in an assets framework 3 different types of assets that all shape access to health-promoting resources. So what are those assets? They are financial assets, physical assets, and social assets. So the financial assets that can shape your access to health-promoting resources include income, yes, but also savings, debt, different types of insurance, and credit, because credit changes your ability to access other resources. It gives you that capital to access resources that we know produce health, such as stable housing, a car to get to and from work, and preferential rates when you are trying to purchase goods in society so that you can keep more of the money you earn. And in our assets framework, we also looked at physical assets and social assets. So physical assets, those do include home ownership, auto ownership, devices, cell phones, laptops, and social assets to include education, marital status, as well as religious attainment and employment. So credit scores can shape people's ability to access these core drivers that help keep people healthy. So when people have high credit scores, they are better able to keep the money they earn because they get better rates when they're paying for insurance, when they're paying for their mortgages, and they're able to do things like keep jobs, get jobs, and also rent apartments, which all help keep people healthy.
Knowing that a lower credit score is associated with higher anxiety and depression, what do you do with this information?
Well, one thing I just want to clarify is that in the study, we looked at area-level credit scores. So we looked at these aggregate credit scores within a zip code. So an area-level credit score is the combination of the individual. So on the one hand, it's a proxy for individual, but it also might indicate something beyond individual credit scores. And it might help us understand what we call the credit economy in an area. So if an area has higher credit scores in general, that area may have better economic opportunities. It may have more traditional banking institutions, fewer predatory banking institutions that provide, for example, payday loans, and the types of financial devices and products that have really high rates that are not helpful for people who are trying to keep the money that they earn. So at that area level, it suggests to us that perhaps areas with very low credit scores on average may have fewer economic opportunities in that area. They may have more predatory financial challenges in those spaces. And from a policy perspective, these areas may provide an opportunity for intervention to help the individuals who live in that area to raise their credit scores through creating more opportunities, through assessing the built environment, and through understanding what is happening in the economy so that people can build assets to keep the money that they earn and build wealth over time, which we know is really important for mental health.
Mm-hmm. So now that you have this information, where do you go?
Well, our team is working on a number of studies that are looking at different types of financial assets and different types of policies that help to protect consumers, that help people grow awareness about their own finances, and that really do allow families from all different backgrounds to accrue assets. We're thankful to have support from colleagues at the university and policymakers across the country to understand the impact of different types of policies that can help build wealth, particularly in low-income families, whether it's through financial education and or through wealth-building opportunities such as baby bonds, which provide cash infusions for families with low income so that children, when they come of age, have a little nest egg. They have assets that they can then use to, for example, buy a home or get education and have strong financial well-being that will protect their mental health.
So your research, you hope, will promote some changes in policy. Are there specific things that you're eyeing?
Our group is really interested in baby bonds. So baby bonds are this policy that I've discussed that provide these trust funds for children from low-income families. So, for example, the state of Connecticut implemented the first statewide baby bond program in the United States. So, as of July 2023, Connecticut has provided $3,200 in a trust fund for babies born on Medicaid or on Husky Care. So, this is Connecticut's Medicaid. Those are low-income children. So that children born on Medicaid are able to have access to these funds when they come of age. And between the age of 18 and 30, they can take out a pro rata share of this trust fund for wealth building activities, whether it's buying a home, starting a business, paying for higher education, or even investing in retirement. And the goal is really to even the playing field so that children who come from families that don't necessarily have wealth or don't necessarily have a background in building credit can have a fair chance at participating in the economy and having assets that we know protect health.
I've been hearing more about these recently. Is there evidence that this works?
There are some promising studies. So, for example, the Oklahoma seed experiment looked at a form of baby bonds. And what they found was, for example, mothers had reduced depression for the mothers whose babies received these baby bonds, which is amazing because the mothers themselves didn't receive the funds. The funds were for their children, and their children could only access them when they came of age. So this is really promising, and it suggests to us that even this idea of the ability to accrue assets, the ability to build wealth can hopefully build not only strength in individuals, but in their families and their communities.
It has always troubled me, the role that credit scores can play, and that it becomes sort of a poor tax. If you're already poor, everything gets piled on. And I'm wondering, is that what was intended?
I don't know what was intended. I think the goal of credit scores is to allow banks to understand the risk of taking on credit and engaging consumers. So I want to think that the idea comes from a good place, that it's a system that allows banks and other institutions to loan out money to individuals. But if individuals or their families don't know how to navigate that system, it may exclude them from that system. And so something we're trying to do is break down those barriers so that all families can participate in the credit economy and can understand it. Because certainly if people do not use credit well, it can have really detrimental effects. And it can be very challenging to get out of debt, particularly if people are in debt spirals.
I wanted to ask about something I've been reading about in the news lately, which is the idea of medical debt and credit scores. It's complicated, I understand, but there have been efforts to remove medical debt, which can be very, a large amount of money sent to collection agencies, from the credit scores. And I'm curious if you could give us just a little picture of what's going on there.
Sure. So it's estimated that 220 million consumers have credit reports. And among those, collections efforts on medical debt affects the reports of 1 in 3 consumers with credit reports. And medical debt is a problem in the United States. So it is estimated that around 8% of U.S. adults have medical debt, and that people in the United States have an estimated $220 billion in medical debt. And medical debt can be small amounts, so about 14 million people, or 6% of adults, owe just under $1,000 in medical debt, but around 3 million people owe medical debt of more than $10,000. So medical debt is certainly a challenge that people have, and it's not only something that affects those without insurance. So people with insurance still can accrue medical debt. This is something that I teach my students in our Introduction to U.S. Healthcare Systems class. That medical debt is a challenge, and certainly these collection efforts can contribute to people's credit scores. So in terms of the political landscape and the policy landscape, it is evolving. In April of 2023, the 3 main credit agencies decided amongst themselves not to add medical debt under collections under $500 to credit score reports. So that meant that medical debt over $500 could be reported and could be included in credit scores, but under $500 was not going to be included anymore. They also extended the period of medical debt from 6 months to 12 months, making it a little bit more generous for people to pay off those bills before they started affecting their credit cards. The good news is that policy seems to still be in place. There have been efforts at the federal level to make those protections more generous, to, for example, eliminate all medical debt from credit scores, including debts over $500. But those have gone to the courts and are back and forth. However, the good news is that those 3 credit agencies have decided to keep removing the $500 or less from credit scores.
Catherine Ettman, thanks so much for joining me.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.